So, cognitive behavioural therapy as a treatment for schizophrenia. So, cognitive behavioural therapy for schizophrenia can take between 5 and 20 sessions, and it can be delivered either in a group session or a one-to-one session. So, as the cognitive approach believes that schizophrenia is the result of distorted and faulty thinking and thought processes, CBT or CBTP for schizophrenia is going to try and bring about those distorted thinkings and deal with that faulty thinking. So it will make connections between a patient's feelings and thought patterns that are the cause of the behaviour and make the person aware of their distorted cognition perceptions. And it will try to challenge their interpretation of events and help them to change their habit of thinking about things in an irrational way. So it will try to challenge and change those irrational thought processes into rational ones. So it typically involves identifying a particular problem that the individual has. So for example, it could be auditory hallucinations or delusional beliefs, and what triggers the problem and strategies that could be used to help the person deal with the problem. So for delusions, the patient is made to consider the evidence in a hope that it will, or they will realise that there's an alternative explanation. So for example, a patient who believes that they can predict the future may be asked to predict what will happen. Next, when the therapist pauses a TV show. So this allows them to test out their beliefs, and the patient can acknowledge that their thought processes were faulty and they can change it. The therapist will also set out behavioural assignments for the patient to challenge any dysfunctional thoughts and to encourage levels of functioning. So one strength of the treatment is there's supporting evidence to suggest that it is an effective treatment of schizophrenia, in particular in shortening the length of the schizophrenic episode. So Lewis found that CBT was, if it was used during that first episode of schizophrenia, it shortened the length of that episode. So therefore it implies that it is an effective treatment for schizophrenia. However, a weakness is there is contradictory evidence. So a meta-analysis carried out by NICE found on 2,118 patients showed that it did not statistically improve the outcomes between CBT and standard care. For outcomes related to mortality and relapse and treatment adherence. So it suggests that CBT is not effective in the long term in treating schizophrenia. Equally, it was difficult to conclude whether improvements are due to CBT or drug treatments. So typically the individuals that are taking part in cognitive behavioural therapy are also on antipsychotic treatments and antipsychotic medication. So therefore the validity of the research is reduced due to these methodological issues, and it weakens the assumption that CBT is an effective treatment, as results could be down to drug treatments rather than CBT. So in terms of some evaluation-based questions, briefly outline how cognitive behavioural therapy is used to treat schizophrenia, and explain one limitation of CBT in treatment of schizophrenia. So this has been a bit more specific in terms of its evaluation. It's specifying it wants one limitation of CBT as a treatment of schizophrenia. So you could talk about contradictory evidence or the difficulty of concluding whether it's down to CBT or drug treatments. And then outline and evaluate psychological treatments of schizophrenia for 16 marks.